Today, we have with us our Chief Patron, Dr. G. Arun Maiya, Dean, Manipal College of Health Professions, MAHE. And we are honored by the presence of Ms. Kavita Narayan, Advisor, HRH for Health Systems at Ministry of Health and Family Welfare, Government of India. So I request Ms. Pratibha Todur, Head of the Department of Respiratory Therapy, Manipal College of Health Professions, MAHE, to welcome the gathering.
Thank you, Binoy. Good evening, everyone. It's my pleasure to welcome all the participants for this two-day event on Fundamentals of Respiratory Care in COVID-19, organized by Manipal College of Health Professionals, MAHE Manipal, in association with Indian Association of Respiratory Care. I welcome our Chief Patron, Dr. Arun Maiya, Dean of Manipal College of Health Professionals, to this event. And I also extend a warm welcome to today's guest of honor, Ms. Kavita Narayan, Advisor to the National Human Resources for Health Cell at Ministry of Health and Family Welfare, Government of India. A warm welcome to all the national and international speakers, panelists, and IARC fraternity to this two-day event. A special welcome to Dr. Ramkumar sir, who was one of the visionary in starting the respiratory therapy course in India. And I also welcome Dr. Anita Shenoy, who is the editor-in-chief of Indian Journal of Respiratory Care, which is an official journal of Indian Association of Respiratory Care. I welcome the IARC President, Dr. Jerry Paul, Associate Vice President, Ms. Madhura Gauri, General Secretary, Mr. Jithin, Academic Chair, Dr. Manjush to this event. And once again, I extend a warm welcome to each and everyone, especially the faculty colleagues and students who have attended this event. Warm welcome to all of you.
Thank you. I now request Dr. G. Arun Maiya, Dean, Manipal College of Health Professions, Manipal Academy of Higher Education, to deliver the keynote.
Very good evening to each and every one of you. The President of the Indian Association of Respiratory Care, Dr. Jerry Paul, Dr. Kavita Narayan, Technical Advisor, Health Human Resource for the Health System, Ministry of Health and Family Welfare, Government of India, Mr. Jithin K Sreedharan, General Secretary, Indian Association of Respiratory Care, Dr. Manjusha Karthik, Chairman, Indian Academy of Respiratory Care and the Chair Curriculum Board of the IARC, Dr. Ramkumar sir, and as well as Dr. Anita Shenoy, Ms. Pratibha, Head of the Department of Respiratory Therapy of Manipal College of Health Profession, Mr. Binoy, the Senior Faculty of the Department of Respiratory Therapy and also the EC member of the Indian Association of Respiratory Care, the delegates from various parts of the country and the globe, all the office bearer of the Indian Association of Respiratory Care, and all my dear colleagues. Once again, a very cordial welcome to each and every one of you. On behalf of the Manipal College of Health Profession, is the constituent unit of the Manipal Academy of Higher Education, a deemed to be university with the Institute of Eminence status by the Government of India. And also on behalf of the Indian Academy of Respiratory Care, who is hosting this series of lecture today. On this occasion, I would like to appreciate and contribute the role of respiratory therapists on this pandemic. From 2019, December onwards, the COVID-19 pandemic have made a lot of challenges in the healthcare system or even to the general population. Respiratory therapists, being an integral part of the important member of the healthcare system, played an important role in the care of these patients with the varied pathologies and the complications. So, especially in our hospital, our respiratory therapists play significantly an important role in managing the patients with the COVID with various complications. On this occasion, I would like to compliment, congratulate, and thank all the respiratory therapists across the globe for your excellent services for the human being. The Manipal College of Health Profession, I just wanted to highlight one or two important points to all our delegates, is the the first full-fledged and the largest institution in the country for providing quality educations in allied health science. And we are having more than 71 programs, students from 23 countries, and offering at 4 campuses, Manipal, Bangalore, and even Manipal Tata Medical College, Jamshedpur. The Department of Respiratory Therapy is one of the strongest and the vibrant department of our institution. The department was established in 1995 under the leadership of our Dr. Ram Kumar sir in collaborations with the Loma Linda University. I am very pleased to inform to you that this is the first institutions or the university in the country to offer the Bachelor of Respiratory Therapy programs in 1995 in India. And then the department is strengthened by Dr. Anita Shanai, a former head of the Department of the Respiratory Therapy, as well as the professor and former head of the Department of Anesthesiology, and further strengthened by our own various alumni, including Dr. Somi and all other senior faculties. Now the department is doing extremely good under the leadership of Ms. Pratibha, as well as the senior faculty like Binoy and all the faculty members. The most importantly, the 2 days of e-series of this webinar, the Fundamentals of Respiratory Care in COVID-19, the Indian Academy of Respiratory Care, along with the team of MCHP, meticulously planned various topics which are very relevant and appropriate in the current context. I also would like to compliment all the speakers from various parts of the globe for accepting the invitations and delivering an interesting and the important sessions during this e-series. We have with us very eminent personality of the Government of India, Dr. Kavita Narayan, the technical advisor, Health Human Resources for the Health System, the Ministry of Health and Family Welfare, Government of India. She is one of the youngest and the first Indian fellow of the American College of Healthcare Executives Fellowship Award. And we always, even though she is very young, very dynamic, and we call her as the architect in the revolutionary changes of the health systems in India, like various policies for the various disciplines or the professionals, including the medical, nursing, and the allied health profession. Especially for the allied health professional, she played a very significant and an important role in bringing up the both important aspect. One is the regulations, and as well as bringing the uniformity in the curriculum for providing educations in the allied health system, allied health science. From 2012 onwards, the Manipal College of Health Profession, being one of the first and the full-fledged institutions in the country, we have been working very closely with Madam and all the other office bearer of the Government of India in terms of developing the curriculum that is called the National Initiatives of Allied Health Science, NIHAS. Our team, the faculty members of our institutions, played an important role along with or led by the Dr. Kavita Narayan. And the most importantly, the National Commission for Allied and Healthcare Profession Bill 2021 is recently approved both in the Parliament and then the Rajya Sabha. She played a very significant role in establishing in this council for the Indian allied health and healthcare professionals. On behalf of the entire community of allied and healthcare professional team, Madam, I compliment as well as thank you for your excellent work in strengthening our professionals in the country. On behalf of the Manipal College of Health Profession and the Indian Association of Respiratory Care, I extend a very cordial welcome to you to this e-series of webinar on the fundamentals of respiratory care during COVID-19. With this few introductory remarks, once again, I congratulate and compliment both the Indian Association of Respiratory Care, Indian Academy of Respiratory Care, and the Department of Respiratory Therapy of Manipal College of Health Profession for jointly organizing this event. Thanks for the opportunity. I wish all the best to all the delegates, and once again, thanks to all the resource persons for your support to conduct this workshop webinar. Thank you all. Thanks for the opportunity.
Thank you, sir. Now I request our guest of honor, Ms. Kavita Narayan, Advisor, Human Resources for Health Systems at Ministry of Health and Family Welfare, Government of India, to deliver the inaugural address.
Thank you. Thank you so much for those very, very kind words, words of introduction. My hearty congratulations to this rather young group and a young professional group as well of respiratory care therapists. And thank you so much, Dr. Arun, for your very kind words, for Manipal being such a leader in this space, and also for hosting us more than now 9 years ago when we actually started on this journey of really pushing the allied and healthcare professionals to the forefront. And I think many of you may be aware, or some of you may not be, but we've had a very, very long journey in trying to really get to where we are today and getting recognition for over 56 groups of professionals that hopefully we've managed in the literally in the last month is when this act has been passed, or rather 2 months ago. I wanted to take a quick minute to just, really talk about, I just finished a call. We are in a very major committee, as you are aware right now. We're in the middle of COVID. We just finished wave 2 of COVID. We are very much preparing for wave 3 of COVID. And some of you may be aware. So we are on this committee which is actually planning capacity building for the entire country. So I actually am the secretary there for that committee. We have about 15 of India's top doctors, most of the policy professionals, secretaries, etc., from various departments. And we are trying to roll out and build the capacities of close to 80 lakh or 8 million of the health workforce of India in order to really be prepared for the next wave, which maybe we are thinking it could be in 2 months, it could be in 3 months, but there is obviously a very, very big task ahead of us. Very interestingly, we started the last conference call, which was about 3 hours ago, 3 hours long rather, started with respiratory therapy. They had no idea that I was going to come here and speak. But interestingly, Dr. Anjan Trika, Professor Anjan Trika actually heads intensive medicine at the All India Institute of Medical Sciences. And each of these doctors, I had given them work and said, we need to know what to teach, to whom. We are doing something called a role mapping exercise so that we can actually task shift people down. So that what we can do is say, okay, what is the work of the doctor that the doctor needs to be most efficient for? What is the work that maybe a physiotherapist can undertake? What is the work that a respiratory care therapist can undertake, etc. I'm telling you all this because as an inaugural address, I don't want to be making any formal comments. I really want everybody on this platform to know the important and critical work that each of you play, and the fact that it is important for organizations and associations such as yours to get the word out into the entire, not just in the health systems here in the South, but it was important and interesting because Dr. Trika asked me, he says, do we have respiratory therapists in India? He says, Kavita, you've been in the US and maybe that's where you're looking at this from. So I had to tell him, no, sir, I can assure you that there is a very large, vibrant community of respiratory therapy in India, not just in the United States where I was, and which is where obviously I came back and, I was shocked about sort of not having a large allied group over here, which is why the work started. So then he told me, he said, what do they study? Do they have a curriculum? Do they have, standardized courses? Who knows what they're doing? So we had a 30-minute discussion at the level of all the committee the secretaries of various departments today and some of the highest, level professors in the country today on respiratory therapy, not because of anything else, but because people were even shocked in some parts of the country to know that there are respiratory therapists in India. This means that there is work to be done also, right? It means that the word has to get out. It means that it should not just be in a Manipal or in a, Christian Medical College, Vellore. We have to have respiratory therapy at AIIMS. We have to have respiratory therapy posts created in government colleges. We have to ensure that respiratory therapy and several other allied groups are out, so that particularly for ICU management, where we are struggling, and I lead the HRH effort for the entire country. And here we are, trying so hard to deploy our resources, trying hard to make our doctors efficient. You are such a massive group in order to help us do that. And particularly in the times of COVID, you'll have played such a major role. It is critical now for this to get into the mainstream a lot more. And mainstreaming happens in India, in the policy circles, only when it goes into the government institutions as well. So it is important. In fact, one of the very first things I'm going to do after I get back is going to ask you all to share the contents of this very, very interesting, e-conference that's happening over the next couple of days, because I would like to take it and share it with everybody in Delhi and everybody in the rest of the country and say, here is the, some of the modules that these people are looking at. Here is their curriculum. Here is what they're actually studying. So it's my job, obviously, to do that. But I think there is obviously also a role of this group of you all to continue to do the good work that you are doing, to increase the level of professionalism and increase the level of outreach to tell people that there is a very important role. It is such a critical group. Obviously, I don't need to be told that because I'm aware. Dr. Arun doesn't need to be told that, but it is important to get this word out in the larger community as well. And that really happens by us professionalizing this profession further, by getting, more standardized, by getting in place protocols, by ensuring that we are following, checklists. We spoke about all the right things, and we are speaking about it in all the large meetings, but we need more people to sort of come forth and also and we need a large group of you. I think the 2,000 or 3,000 or the small numbers that we have now are going to have to really multiply in large numbers. And we are going to have to see respiratory care in every single, tertiary, secondary and tertiary facility in India. And so that's a large sort of roadmap ahead of, us, as I see, for India. So there's a lot of exciting work here that needs to happen. I really wanted to sort of just take maybe 2 minutes to also talk to you all about the journey, and sort of how this has evolved for us over the last so many years. So in 2011, 2012, when I returned from the United States, I used to actually run a large system in the United States called the Emory Healthcare, which is fairly well known. And I'm sure there are several of my colleagues from the US here on this call as well. So, over there, I trained to be a health policy and a health administrator in the US, and I studied and I ran hospitals, built hospitals, came back to India in 2011, and I was thoroughly shocked by the absolute absence of sort of, this cadre as well as many other cadres, and particularly in secondary and tertiary care. The journey from there, particularly through the groups such as the Indian Academy of Respiratory Care, has been a very good one. I think I even came to one of your inaugurals maybe 3 or 4 years ago in Bangalore when Dr. Peter was, I think, probably the chairman at that point. And since then, I have been very, very impressed. I have to thank your secretary, Jithin, who keeps me posted at all points. And I know that your group is also very well abreast of all of the policy changes that are going. So I think you'll have done an excellent job in keeping yourselves abreast of what's going on, both in the policy field and hopefully what's going on in the clinical field as well. I think what will be very, very useful for us as a government, and as we are rolling out, as we are doing COVID care planning, but also larger health system planning, is to know from you all what are all the various ways in which you can be an aid in the health system. So I think one of the things that you can probably talk about even in the next couple of days of a conference is actually to make a list, almost a checklist of saying, here are the things that we are trained to do in the ICU. Here are the things that we are trained to do, in terms of cardiac care. Here are the things that we are trained to do in terms of, neurology, just whatever that may be. But I think the skill sets and what competencies you are actually building as a respiratory care therapist needs to now be outlined in the larger sphere and in the larger context. And I would be very, very happy to be your agent to sort of communicate that to the larger, to the larger world out there, if you will, within India, so that people are aware. Because I know that every doctor would be thrilled to have a respiratory therapist in his or her ICU or in his theater to sort of help, but they're not even aware. So I would put this onus on you all, in fact, a challenge over the next couple of days for you all to really brainstorm that and also come out with how do you get that word out? And what are some of the modules that you already have that we can actually take on and maybe even integrate as part of our larger capacity building initiative? We are now, like I told you, I have a very small task. We have to only get 8 million people ready and trained in the next 2 months, for COVID. I mean, it's just a piece of cake, no problem at all. So we are basically losing sleep. We have no idea what's going on right now and how we're going to do this, but we are looking for all resources, and the most professional resources that we have, that's what's really going to help us in moving this sort of, this fight forward. So I would really urge you again to be very systematic in saying, here are some of the things that we can help in, and here are the roles we can play clinically that we are trained to do and that we feel very confident to do. And I would work very closely with your friends from the intensivists, the pulmonologists, your anesthesia friends, so that can, because it's really a team, as you well know, between the two, right? I mean, you cannot, this team playership and the multidisciplinary care aspect is one that we really, really are pushing for now, finally in India after all these years. And I feel like I'm ready to, sort of retire if required, because it's such a major paradigm shift in what we've seen versus a dialogue which only had doctors and maybe nurses and nobody else. And until that dialogue changes into one that brings on board every other different discipline and professionalizes them to be doing their work to the best of their ability, we knew that we wouldn't be able to change the health system. We really did not want COVID to be here to have us teach us that. But that's what COVID has done in some ways. And we are very, very glad that for that part, not of the other parts of COVID, but COVID has really enabled us to push on some of these larger health system reforms sort of faster. And one of the most important ones we are doing is task shifting. So task shifting effectively, task shifting competently, task shifting safely, putting the patient to the center of care. This is a very new dialogue, not the doctor, not the nurse, not the hospital, but putting the patient at the center of the safety matrix so that everybody else is working around them as a multidisciplinary team, and every single professional is doing his or her job to the best of their ability, not being worried about, the hierarchy, not being worried about other things. And that's really the vision for, at least for me, for the health system. If we have a system where we can develop professionals such as you all, but a lot more of you all, like I said, I think we would have really, I mean, it may be a few years before we see that, but that's okay. We've at least sown the seeds, and we have done, I think we've done the right things. Now we've got to water it very, very consistently. I cannot, I would be really remiss if I did not mention the fantastic work that an institution like Manipal does, and have been continuing to do that over the last decade or so, in really recognizing the potential of these professions and having an exclusive college and a school of allied health sciences. I think now you call them health professions. And I think that's commendable to you and your work, Dr. Arun, and to all of your predecessors, because I worked with many of them. And there are very few, unfortunately, colleges that we have. But like I said, again, I would like to see a respiratory program at the All India Institute of Medical Sciences. I would like to see it at the PGI, JIPMER, and every other institute, so that this then becomes mainstream. I also have to say that for many of the state governments I have worked with, and where all of you have provided care during COVID, they have been extremely complimentary. So for the few of you who were able to go, I think we've taken lists from you all and sent some of the names to many state governments. The state governments have been so thrilled. They were like, oh, who are these people? They're so good. They're so well trained. So it's sort of new for them to see this. But I would wish that every state government is able to add you all to their roles. So we have a large number. And COVID really is going to, it sort of made the earth more flat than we've ever known. So I attended the World Health Assembly virtually, a couple of weeks ago at WHO, and the last report that we wrote said that the world will be short of about 8 million work by 2030. That number has already gone to 30 million now. We've just, thanks to COVID, a huge shortfall has been predicted. So the kind of numbers that we are looking at as a world is, is not even funny. It's actually a really, really large number that we're looking at. Are you all able to hear me? Yes?
Yes, ma'am.
Are you able to hear me?
Yes, ma'am.
Can somebody just give me feedback, because it tells me my internet is unstable. So I wasn't sure if I was just speaking into thin air here. So do tell me. Okay, thank you. Yeah. So yeah, thanks. So one of the things that I think there is potential for, even in respiratory therapy, is to look at, are there more specializations? Will you go down and, then start looking at, can we look at master's programs? Can we look at PhDs? Can we look at, doctoral programs? Because I think every profession should go to the highest level of its, of its competence. So is there a way for you to then specialize? Are we looking at, sleep labs? Are we looking at sleep centers? Are we looking at, there is a whole host of things that are there that need to be done that we haven't explored really in India today yet. So it really is a large expanse, if you will. COVID today has taught us that, there is COVID long haul that all of us have heard of, right? Suddenly there are all these cardiac issues that have come up, and we don't have enough cardiologists in this country for the cardiologists to be involved in doing an ECG or in doing, there are neurological issues. We need to be doing sleep studying people. People are having insomnia. I mean, the problems of just the COVID patients are long and endless. And I can promise you, we do not have the number of health professionals at this point that are well trained to be able to look through even those issues. So it's not just treating for COVID, because that's just emergency management. Patients coming in, we're maybe putting them on a ventilator if required, we're managing them, and and then we discharge them. But then what? Who's following up on them? What are the kind of follow-up that's happening? What kind of studies are we doing to see, have we actually retained the quality of life of this individual? Because if we haven't, then we have also impacted the economy. 10 years from now, 20 years from now, we may have just a bunch of sick people and that's just not for India. That's obviously an issue all over the world. But I think we have an opportunity here in order to ensure that there is a whole amount of wellness and longevity of life that we can do through the, the skills of professions such as yourselves. So do aim to think big when you look over the next couple of days. So as you're learning, look at sort of what are the possibilities and what are the various ways in which you can be those hands and feet and the brain, if you will, to these intensivists, to the neurosurgeons, to the cardiologists, to the various large groups that you actually can potentially help sort of bolster and help up. So I will really just end my comments with saying that this is an exemplary effort for during COVID, despite everything, for you all to continue doing learning and lifelong learning. I mean, that's what I was trained as a fellow of the American College, is that you don't stop learning till the moment you breathe. As long as you're alive, you keep learning. Because the day you stop learning is the day you're officially dead, as far as I'm concerned. I mean, you may keep breathing, but there's not really much value you're contributing to. So keep learning. It's very important, right? We all keep learning. We learn every day, and keep sharing. And let's all together make sure that, we come together to sort of deal with one of the most unprecedented and completely bizarre times that we are going through in the world. But there's nothing that we cannot do if we all put our minds together. So with that, congratulations again to the organizers, to the IARC, to Manipal University, to all of our colleagues who have joined us from various different parts of the world. I'm presuming you are either awake very early or staying up late. So thank you for doing that. And many congratulations to all of you on behalf of the Government of India as well. Thank you.
Thank you, ma'am, for your very encouraging words of support and encouragement. So I now request Mr. Jithin K Sreedharan, General Secretary of Indian Academy of Indian Association of Respiratory Care and the Governor for India, Indian Council for International Council for Respiratory Care, to deliver the opening remarks.
Thank you, Binoy. I didn't hear the last word. It is for me, right? Can I? Okay, fine. Thank you. Thank you so much, dear Dr. Arun Maiya, Dean of the Manipal College of Allied Health Professions, Chief Patron. On behalf of IARC, thank you so much for consenting to collaborate and doing everything possible to organize this meaningful scientific symposium. And it was a quick arrangement, and we managed to succeed. Ms. Kavita Madam from Ministry of Health, I welcome you and thank you for joining us today from a very busy schedule. We are indebted to you for all what you're doing at the Ministry for regularizing the allied health profession and bringing recognition for respiratory therapy profession in the country. We welcome you, Madam, for this event. Thank you so much for instilling so much hope in us, for following our generation to follow, and you are lighting fire for them. The same thing happened in 2018 when we met in Bangalore. We took your words with utmost respect and priority. One of the advices that you made to us is to prepare a curriculum, a standardized curriculum. And today I say to you that as we are ready with a full-fledged, unified, unique curriculum, and we are ready to submit it to the Government of India, which is formulated with a consortium of almost every universities who run the program in our country. And we identified, of course, as you mentioned, that we identified 15 subspecialties in respiratory therapy, and we have a unified job description, which is reviewed by the national and international panels. We launched fellowship programs for spreading the word. We are doing continuous scientific activities. And it is with immense pleasure today I say that this is the 33rd scientific program, jointly organized by Indian Academy and IARC. That accounts average of 2 to 3 programs per month since coronavirus appeared in our country 14 months before. Moreover, with the exemplary leadership of our mentor, Dr. Anita Shinoy, Madam, with the outstanding support of the editorial board members, we launched a special COVID-19 issue of our journal, which I don't think even across the globe, if you take, there is no such special issue has been launched with a focus to the COVID. During this difficult time, we signed 7 MOUs with different universities for actively involving in the development of unifying respiratory therapy program. And further to that, there are many under development and they are in line. Thanks to the leadership team of the Academy, Ms. Dr. Manjush, Ms. Tisha, Ms. Madhura, Mr. Varun, Ms. Mritula, Mr. Kishore, Gokul, and a lot more people, which I have a lot in my list for their tremendous effort and support that you have given for IARC and for our profession. Most of us are working abroad. Still, we are able to contribute to the best of our abilities for the development of this program in the country. And our juniors are following us, and we are giving constant guidance for them. We have a full online platform for guiding them. We have courses to run. A lot of things are happening. So our future is exciting. We have Mr. Daniel Rowley here from the United States. Is the Honorable President of the International Council for Respiratory Care. Welcome to India, sir, and take this message from me on behalf of the authorities and respiratory therapists in the country. We are immensely thankful for the unconditional support you provided during this difficult time. I would like to inform everyone that this, with his sole efforts, hundreds of well-versed RT groups. I have a specific list of people, maybe more than 1,000 people lined up behind IARC under the banner of ICRC to join us in the fight against COVID-19 when the second wave happened. I would like to call him as the most sensational president ever in the history of ICRC, who really showed the potential of this particular council to the entire countries. We have 40 countries partnering in this particular council, and our message is going up everywhere. And the country, our country, in terms of respiratory therapy and respiratory care and our fight against COVID-19, and the role that you all are doing in the intensive care units and saving the patients, home care, setting up ICUs. Some RTs, we set up dedicated ICU in rural area, 2 dedicated ICUs in rural areas for helping. This is amazing. This is just outstanding support that everyone has given. The doctors community is just behind us to support us. They actually need us badly. They are in need of us. So as a result of that, we the first society that identified us and our contribution is the Indian Society of Critical Care Medicine. We signed our first MOU in March 1st. March 3rd, I arrived in Saudi Arabia back after signing the MOU, and we went on shutdown. After that, I could not travel back. Still, I'm stuck here. However, we are reaching somewhere. All the distinguished panel, faculty panel from across the globe, who most respected frontline healthcare providers, the faculty panel who joined us here. Most of our presentations are referring to your studies, your guidelines, your presentations. It is really a scientific fiesta for the young generation of RTs in the country. The key aim of this educational series is to enhance the skillful knowledge of all healthcare professionals to effectively manage acutely ill patients. And I hope there are a diverse group of healthcare professionals attending this program. We had nearly 700 registrations today, and I hope to continue the same for tomorrow as well. We consider this as a commitment to our motherland to support its healthcare providers when they are in need. Our small initiative is well taken by the prominent university and authorities of the country. The next program in line is in collaboration with All India Institute of Medical Sciences on the first week of July. And in the middle itself, every weekend or weekdays, we have isolated dedicated programs as well going on. Our YouTube channel, if you look at that, it is filled with a bunch of videos and huge number of views in multiple languages. We, in collaboration with All India Institute of Medical Sciences, created 5 awareness videos for the public for general COVID care awareness. And day before yesterday, we launched it. It is continued to be released in the next 5 days as a sequence. So one of the biggest lessons, to conclude with this, one of the biggest lessons we have learned from this COVID is that we as a very, very small scientific community working together can do some pretty amazing things. We befriended with the technology on a lighter note. This pandemic surely has brought us out our interest. We have seen chefs, artists, dancers, and writers who are actually doctors, artists, and corporates by profession. looks like we have found what we really like to do. And at the end of the day, all that matters is that what you like to do, and your happiness while doing what you like. And I like to do what I'm doing now, and I wish all of you should contribute towards the growth of the profession in our country. Be proud what you're doing. Join hands together for the good sake of our profession. Contribute your part. Grow together and accomplish all our tasks. Thank you for taking part in this wonderful event. Thanks to Kavita Madam. Thanks to Rauli. Thanks to Manipal College of Health Sciences and Dr. Arun and the entire faculty and colleagues of Respiratory Therapy program at Manipal University for this wonderful event. Thank you so much. Thank you so much for this great opportunity.
Thank you, sir. I now request Mr. Varun Nayak, Board Member, FARC-ACC, and Assistant Professor, Department of Respiratory Therapy, MCHP, Manipal Academy of Higher Education, to propose the vote of thanks.
Thank you, Binoy. Am I audible?
Yes, Varun.
Yeah, a very good evening to you all. It is my privilege to have been asked to propose a vote of thanks on this fine occasion. On behalf of Manipal College of Health Professions and Indian Association of Respiratory Care, I extend my sincere thanks to the distinguished guest of honor, Ms. Kavita Narayan, Advisor, HRH for Health Systems at Ministry of Health and Family Welfare, Government of India, for taking time out of busy schedule to grace this occasion. Thank you, Madam. I also extend my sincere thanks to Dr. G. Arun Maiya, Dean, Manipal College of Health Professions, Manipal Academy of Higher Education, for all the guidance and support you have provided for the success of this workshop. Thank you, sir. I would like to extend my sincere thanks to the President of Indian Association of Respiratory Care, Dr. Jerry Paul, for all the guidance and support. I would like to extend my sincere thanks to Mr. Jithin K Sreedharan, General Secretary, Indian Association of Respiratory Care and Governor for India, ICRC, and also Dr. Manjush Karthika, Chairperson, Indian Academy of Respiratory Care, and all the office bearers of the Indian Association of Respiratory Care and the Indian Association of Indian Academy of Respiratory Care for their effort behind the smooth conduct of this workshop. I also extend my sincere thanks to the head of the Department of Respiratory Therapy, Ms. Pratibha Todur, for her guidance and support, and also to Mr. Binoy Kuriakose, who has worked hard for the success of this program. I thank all the speakers who have happily accepted the task and finding time to sharing their valuable knowledge with us during this workshop. Last but not least, I thank all the participants who have joined for this two-day ECOS jointly organized by Department of Respiratory Therapy, Manipal College of Health Profession, and the Indian Association of Respiratory Care. Thank you all and have a happy learning session. Thank you.